just setting a stage, cardiovascular disease in Singapore is still the #1 killer if you combine it with cardiocerebral events. So it accounts for 1 to 3 deaths in Singapore, and if you combine both, it's still the largest cause of mortality in Singapore. It's not as sexy as sounding as cancer research, but it's still something we need to pay attention to. Next slide, please. So we know that nowadays it's bread and butter to treat coronary artery disease. Most patients and general public in Singapore is quite aware of the standard of care treatment in opening up a blocked artery, whether acutely in a heart attack or chronically with stents. And the current generation gold standard therapy is drug-eluting stents, where once we implant this wire mesh, which is coated with medication, it prevents re-narrowing from happening in the artery and over immediate and long term. But the problem for the current generation of drug-eluting stent is that there's still a 2 to 3% cumulative event rate after the stent is implanted all the way out to 10 years. So 2 to 3% of the patients will still have this catch-up cardiac event rates after a gold standard drug-eluting stents are implanted at the moment, whether it's re-narrowing or heart attack. Next, please. So the event rates remain high with current generation drug-eluting stents, and this can occur about 2 to 3% per annum compounded. And it can be due to the fact that ultimately we're implanting a foreign material, especially a metallic stent that is an artificial rigid platform inside a flexible coronary human artery. So it can be due to the fact that the stents can fracture. The vessel will lose its compliance, it can't move, it can't constrict or dilate, and it doesn't have the capacity after it's caged for active vascular adaptive remodeling or the ability to recover, so to speak. Next. So this latest technology, the DynamX Coronary Bioadaptor stent from Alexa, is very interesting. It allows the stent to actually uncage itself over a period of 6 months. So usually the cells or the stents have large cells that is joined by these interlocking links. And in this stent, which is also drug coated, there's 2 layers, one layer combining biodegraded polymer that captures the drug that elutes over 3 months. The other layer, slightly thicker, helps bind the joints, the locking joints between the links that degrades over 6 months. So at the end of 3 months, the drugs are eluted. At the end of 6 months, the caging polymer is fully eluted, and the stents is then uncaged, so to speak. It's a bit difficult to appreciate, but this small video shows that actually once it's uncaged, there's more mobility for the stents to follow the vascular contraction within a coronary artery. Next, please. So this picture may be a bit more useful to look at. If you compare the picture on the left, the DES cage picture, with the same similar type of movement seen in the DynamX uncaged after 6 months, I'm not too sure we can appreciate the fact that the stent on the right side of the vessel on the right side after 6 months has more mobility, the ability to constrict or contract or relax. Next, please. So I think there's an opportunity. This is my closing slide. I think it seems attractive to me that metallic stents does not then have the ability to cage the vessel for the long term. And there's a potential that the coronary artery can restore or return to normal vasomotor function. And I think that's important so that the vessel can possibly remodel or dilate. So the promise of this new technology, the DynamX Bioadaptor, is in addressing this 2 to 3% adverse event rate or the Achilles heel currently of the drug-eluting stent. And potentially our hope is that this technology can improve long-term patient outcomes. So thank you very much for your attention.